Hi there. This video is about how you use our pathology system and particularly the template to review individual patients with their lipid results and record outcomes and things. Now, the idea of the system is that we minimize the amount of kind of patient contact that's needed to manage those lipids. So often patients will be sent information, sent questionnaires, but there are some outcomes that, of course, need an appointment or need some conversation or some kind of notes review. So in our pathology overview on the lipids page, you can see what's going on. You can see from the recent lipids here, it's directing staff to book a telephone review to discuss them. And then you can see a bit more information here that they need an assessment or referral for possible familial hypercholesterolemia due to total cholesterol of more than 7.5 with a family history of CVD. Now, for some areas, that's not a criteria. It's accepted as a reason to refer, so that might be excluded in your area. But for this particular area and this patient, that's the reason. So the idea is we've got useful information here. We can see the last few LDL, non-DL, total cholesterol levels. You see the last one is really raised. We can see the family history and more data there. On the right-hand side, we've got information to record outcomes. So for this particular patient, you'd be looking at referral options. So you can either tick to say you have referred, either to lipid clinic or for assessment of FHC, or it might be that it's been declined. There's also a kind of catch-all option to say lipids, no further action. Might be all sorts of reasons for that you might want to record a quick note of, but that will take them out of those reports to review, and it would clear these alerts here. Sorry, I had to stop the recording, come back in again to avoid any patient data appearing on the screen. So this one here, a bit different. This patient has completed a statin dose increase questionnaire. I'm not going to expand that because that shows the patient name. But the first question that we ask is, are you taking your statin regularly? And this patient said, I want to discuss it. And that kind of fits because it looks like they've not ordered for a little while. They're on a receiver, but interestingly, you can see their non-HDL has jumped right up there. So clearly that's what the issue is. If you're seeing the patient, you've got here a nice little table to consider alternatives. You've got options to record if you change the statin, increase the dose. If you discuss the questionnaire answers, all of these sorts of options will, again, take the patients out of the list to review, mark that it's been complete, and also kind of aid your data entry. Let's see if we can go to the next one without any patient data appearing. Looks okay. So to get to the pathology overview, by the way, probably worth having on your toolbar if you're using it a lot, but it's always available on patient records here with this green graph with the red line. And looks like we're okay this time. So I can show you briefly the overview. You can see that there's again a book a med discussion to discuss a raised cholesterol. A bit more detail here. If we come to the specific page, there's a lot more information. So again, it's explaining the rationale here. So they've got an alternative lipid regulating agent on repeat. In this case, ezetimibe. Latest LDL is more than 2, so it's above target. And you might want to consider adding another option. Now, essentially what the system will do as much as possible is it will kind of titrate up to a Torva 80 and then add on ezetimibe 10. Once it gets to that stage, or if like this, they've got the ezetimibe but not the Atorva bit, then it more goes into list to review. And that might be for an appointment, or you may prefer to just do a notes-based review in the first instance. So again, you've got hopefully the information that you need, and you've got options over here to record what the outcome is. As much as possible, as ever, we're trying to make this self-explanatory. If there's stuff here that's not clear or things that you think are missing or whatever it might be, please let us know. I hope this video helps make sense of it all for you. Thanks.